Dr. Matt Marr with Advanced Health and Wellness Center of Wadsworth, Ohio. Today I'd like to provide some important information on spinal disc issues. Now, did you know that a diagnosis of a disc bulge or a disc herniation doesn't have to be treated with potentially invasive surgery or addictive pain medications? Let's begin by taking a look at what a diagnosis of a disc bulge or disc herniation truly means. So when we look at the spine is made up of 24 freely movable vertebrae that sit on top of a tailbone, also known as your sacrum. Now, when we look at the spine from the front, I want everything to be straight, but from the sides, I want to see curves in the spine, and these curves allow for proper shock absorption to happen as we move and do activities throughout the day. Now, an important issue we look at is in between each of the vertebrae are these intervertebral discs, also known as spinal discs. They're made up of two important things: the outer layer, which is like a thick outer coating, and then the inner layer, which is a gel-like substance, much like a jelly donut. So these discs allow for shock absorption to happen, and they allow for the vertebra to pivot, allowing normal movement to happen throughout the day. So that's an important part, because as we move, nutrients are pulled into these discs because they don't have a good blood supply on their own. Unfortunately though, what happens throughout the day is we can get ourselves in bad postures, whether it be sitting, we can have improper lifting, we can even have accidents, falls, traumas, car accidents, and all of these things disrupt the normal motion and alignment in the spine. So when that happens, it can put extra pressure on the disc. So in this case, if you think of the disc like that jelly donut again, if one side of a jelly donut, or even think of a water balloon, if one side gets compressed, what happens to the other side? It starts to bulge out the opposite direction. Very much same like the disc. If too much pressure, because we lose normal alignment and motion in our spine, happens at that disc, the pressure builds up and the outer wall can weaken. Now over time, as that weakens, it can start to bulge out in that direction. Now if that remains uncorrected for a long enough period of time, the wall weakens to a point where the inner gel-like layer can actually herniate through the outer disc wall, leading to a disc herniation. Both a disc bulge and a disc herniation can lead to some pretty painful symptoms, such as localized pain, sciatica, numbness, and even weakness. So to merely treat those symptoms is kind of like doing a patch job on that. If we want to truly get to the root cause of the problem, we have to look at the normal alignment and the normal motion in the spine. And this can be done without the need for surgery or even pain medication. Here at Advanced Health and Wellness Center, we focus on restoring normal alignment and motion to the spine, and we do this through a combination of medical, chiropractic, and rehabilitative services. For a complimentary consultation, please contact us at 330-336-9500.